Hi, this is Dr. Nemechek with the Nemechek Protocol, and want to talk to you about a frequent issue that parents have to deal with, and that's with a kid that always seems hungry. And so, what is this about? You know, why are they just constantly? They just had dinner, and they're hungry again. All right. There's a couple things that do this. One is just simple, what we call hedonistic pleasure. I mean, if there's yummy food to be had, so if you have a plate of fresh brownies or chocolate chip cookies or something like that sitting around, heck, I feel hungry all the time, okay? But we aren't really talking about those things, those are kind of obvious. The two major things that drive this are one, you can have some nausea, and at times people have hunger, and it helps with the nausea. And that tends to be pretty self-evident when that's going on, because you're also like, I'm sick, or you have some other intestinal symptoms or things like that. Now, the way to sort that out is a little antacid like a Tums or sodium bicarbonate or something like that that works right away, tends to resolve that hunger if it's from nausea, all right? But the biggest issue that we deal with is autonomic dysfunction. Back to the old autonomic nervous system. What happens is, as we have injuries to the autonomic nervous system and we don't recover through the process I refer to as cumulative brain injury, what happens is we have more and more difficulty. Here's my old pen again. So here's your head. We have more and more difficulty driving blood pressure up against gravity to our head. And this, as I've discussed, can give you fatigue and ADD. Can make people really fidgety because that moving muscles drives blood pressure up to the head. But the brain doesn't like this lack of oxygen. The brain actually thinks it's quite threatening and maybe even might die. Now, we know that won't happen, but this is how the brain is interpreting things on a primitive level. And the brain learns that foods with salt or sweet characteristics will boost blood pressure to your head. So now you're kind of like, I want some pretzels, okay? It'll also make you drink a lot too. But so in particular, so your pressure's dropping, your brain thinks we need more oxygen. The brain commands the child, go find some food with salt or sugar in it. And when that kid eats the salt or sugar, the blood pressure boosts up to their head and the brain is rewarded with more oxygen. All right. One of the times our blood pressure is most difficult to manage is right after a meal. So that's where you have a kid, doesn't even eat all his dinner, says he's full, but in 30 minutes he's kind of like milling around the kitchen looking for in the cabinets for something to eat. This is a very, very common cause of frequent hunger. And this low blood pressure also makes your kid fidgety, makes them anxious, makes it hard to have focus and concentration. They'll get diagnosed with ADD or ADHD, makes them tired. So it does all this, and really one of the symptoms is they're just too hungry. Now, how do we fix this? Well, we got to fix the autonomic nervous system. It's balancing the gut, good doses of a high quality omega-3s from fish oil, and a good quality olive oil to protect you from those toxic omega-6 vegetable oils in the food supply. Alrighty, so that's it for today. This is Dr. Nemechek with the Nemechek Protocol of Nemechek Autonomic Medicine in Buckeye, Arizona. Have a great day.